So good day, everyone, and welcome to the Animal Welfare Group Nigeria webinar series. I'm so excited to have three speakers in our midst, and today's topic promises to be exciting with a lot of insightful tips and knowledge that will be shared with us about health and mental health benefits of human-animal relationships. I am Iyasiri Oluwaseun Sarah, Associate Professor at the Department of Animal Physiology, Federal University of Agriculture, Abeokuta, Nigeria, and also a George Foster Experienced Researcher at the Humboldt University in Berlin. So I want to welcome everybody to today's meeting. I'll be the host for today's meeting, and I'm also the coordinator of the Animal Welfare Group Nigeria. Today we have Lorato, who will be moderating our program for us from Botswana. She has actually been participating in our activities for a long time, so I felt it would be great to have another African, help with the program. Lorato, you're welcome. Thank you so much. Thank you. So before the program commences, I would just like to remind us about the mission of our group. We have three main missions. The first is to increase awareness in animal behavior and welfare in Nigeria, Africa, and the world at large. And secondly is to foster collaboration between researchers who are interested in animal welfare, One Welfare, One Health. And thirdly is to educate the public on the importance of animal welfare. And today we are having Janet, Geraldine, and Vickie. They will be presenting to us about human-animal relationship. Kindly drop your questions in the chat box. We'll take the questions at the end of the presentation. And I hope you find it interesting. Please try to engage as much as possible. So with that, I would like to hand over to the moderator to help introduce our speakers, and then we go on from there. Thank you.
Hello, everyone. Today we're going to talk about health and mental health benefits of human-animal relations. So our first speaker will be Geraldine D'Silva. And then Geraldine D'Silva grew up in India, where she got her bachelor's degree in sociology from the Delhi University. During her time in the university, she traveled and lived in the remote villages of Rajasthan in India, studying the caste system and women's empowerment. She went on to get an MBA from the Edinburgh Business School in Scotland. She worked as a research consultant before moving to the US, where her most notable achievement was leading a small nonprofit organization as an executive director through a successful merger with one of the largest animal welfare groups in the country. And then she's a key collaborator across sectors and has built several innovative partnerships and legacy programs, including a community pantry which distributed over 2 million meals during the COVID-19 pandemic. And then she's currently a human and animal welfare consultant with key contracts, including the Open Door Veterinary Collective and Project Street Vet. She's committed to helping pet families stay together while keeping her lens on a One Health approach. So, and then our next speaker will be Vickie Ramirez. And then Vickie Ramirez is a program manager and research coordinator at the University of Washington's Center for One Health Research. She also coordinates, does outreach, and conducts research and evaluation for the OneHealth Clinic in Seattle. And then as a medical anthropologist by training, she explores ways to reduce barrier to healthcare in those communities with the least access. And then with the OneHealth Clinic team, Vickie helps support national and international organizations trying to replicate the OneHealth Clinic models in their communities. And then last but not least, the last speaker will be Janet Hoy-Gerlach. And then Janet is a clinical social worker, an author, a researcher, and human-animal interaction researcher. She is the lead author of the peer-reviewed book, Human-Animal Interaction, a social work guide, which was published in 2017 by the National Association of Social Work, and founder of OneHealth People Animal Wellness Services. She is also an adjunct facility member at Case Western Reserve University. And then through, through the OneHealth People Animal Wellness Service, she helps to advance practices, programs, and policies that support human-animal relationships for mutual benefits, for mutual well-being. Her research on mental health benefits of animal companionship has been featured in media outlets such as Discover Magazines, Business Insider, Medscape, and Psychology Today. She serves as an expert witness on human-animal bond mental health benefits for the U.S. Department of Justice Civil Rights Division. With all that said, I'll first let the first speaker to start the presentation. Thank you, Dr. Gerald.
Yeah, thank you so much,
Yes.
Loretta, and thank you so much, Shyam, as well, and to all of you for being here with us today. And we're happy to be with you all the way from the United States. So, with that, we're going to get started, and we're going to be talking about the health and mental health benefits of of human and animal relationships. So I thought we could start with maybe, the last 20 years, and just to give you a flashback on where I've come with the work that I'm doing with the goal of One Health in mind, is I was leading an organization that was founded during the AIDS epidemic in 1993. And it was founded to help the HIV and AIDS community who was isolated, and the only companions and family members that they had were their pets. And so, with this organization, we were able to help anyone that was isolated so that we did not break this human animal bond. And then we kind of expanded services. Where we launched a community pet pantry because we realized there were people who were unemployed and living in their cars, who were experiencing homelessness, who also needed help, and were in the same vulnerable situation. We eventually merged with San Diego Humane Society, which is one of the largest organizations in the country. So we were able to expand our reach and have some support with our infrastructure. And during the COVID-19 pandemic, we were already prepared with a safety net to help the community because we anticipated people getting separated from their animals because of the lack of resources. And finally, we were able to set up community veterinary programs with which I'll be talking about in a little bit. I also like to share stories, like real stories of people we've helped. And this is Judy and Angel. And she was a client of ours for many years. She was a senior, chronically ill, homebound. So she was confined to the four walls of her house, and all she had was Angel. And so we used to bring, through our program, home delivery of pet food. We used to walk her dog. We used to provide financial assistance when her dog needed to go to the vet. And because she was in and out of hospital, we used to make sure that we provided temporary boarding. So it had multiple health benefits, like her emotional health was impacted, her physical health, her mental health, because she knew that we were always going to make sure that she was not separated from Angel. And she, like many of the clients that we served, said that their pet was the reason they woke up each morning, and their reason to live. She was also able to age in place, so it had a positive effect on the economy because there were others like her who were not moving into senior centers, and just aging at home. So this is Ray and Licorice, and they were clients of ours for many, many years. And that's Ray on the left when he first became a client, and that's Ray and Licorice on the right, shortly before he died. He was confined to the hospital in the last few weeks before he passed away but his bond with his dog was so strong that he made sure that he convinced the hospital staff to come home so that he could pass away at home beside his dog. So we supported him through the last stages of his passing, and we rehomed his dog, who then had a life living on a ranch, and she was retired from being a service dog. Um, and so, I mean, thinking about, like, where I came from and India, and living in the United States, I recognized the huge need that there is here as well. We were distributing pet food through our program, through the LGBT Center in partnership with the food bank. And we found that there were long lines of people, like wanting just their basic needs. And I've also found that there's a lot of wastage, because in the United States there are huge portions of food and there's a lot of trash. Yet on the other hand, we have factory farming, and I interned on a farm where I found that they were rescuing animals that were from factory farms. So there was kind of a contrast of, like, the surplus of food, yet people needing access to food. And so it connected me back to my roots in India, where we had all kinds of animals coexisting with humans. And not to talk about the zoonotic diseases and things that Vicky's going to mention in her presentation, but like we have elephants and camels and dogs and cats and goats on the road. And we also have communal pets, where we have communities looking after dogs and cats, and many families feeding them. The bottom right picture, which is pretty blurry, is of a monkey entering my parents' home, because we're encroaching on their habitat. So coming back, fast forwarding to the work I was doing here, we were helping homeless veterans at resource fairs, because we found that at these resource fairs they were being helped with their mental and emotional health, for PTSD and other trauma. And we felt that people were not accessing resources for themselves because there was no one to take care of their animals. So we set up shop at these resource fairs. We made sure that the animals were taken care of, and we brought in veterinarians so that we were able to provide a veterinary care directly on site. We then went on to do a pilot study where we identified low income zip codes around San Diego County. And these were like what we call resource deserts. So there were no veterinarians, there were no access to just the basic stores where people could even get pet food for their animals. And we went around and asked people about what was it that they needed for their animals. And what they said was that they needed us to bring our services directly to where they were. And so that's what we did. We started community outreach events. We recognized that if they didn't have veterinarians there, they didn't have regular doctors there as well. And we realized that at our first event, people were lined up more than 3 hours before the event even began. And most people had never taken their dog to a vet before. We also started recognizing families as one unit. And so this beautiful lady on the left is the same lady on the right, who we met a few years apart. And on the left is when she had just lost her job and she was living in what we call a safe parking lot here, because you cannot just live on your car on the road. Otherwise, you will get a ticket and you will end up, in jail. And so there are safe parking lots where you can sleep in the night. And that's where she was with her dog, just so that she could rest at night. And on the right is when we met her a few years later. She had to relinquish that dog because she wasn't able to navigate all the resources she needed for herself in order to get a job. And so she eventually ended up adopting the other dog here on the right that you can see. So through the COVID-19 pandemic, we anticipated that there would be a decrease in access to resources. So we prepared for it by having a safety net of surplus food, and we removed all the barriers to access, so people didn't have to be experiencing homelessness or living in their car necessarily to access the supplies that they needed, because a lot of people were asking for help for the first time in their lives. So we made sure that we trained our staff and our volunteers, and our approach was basically to look at the need and to match our resources to the need. And eventually we expanded to Baja in Mexico. San Diego Humane Society, and San Diego, actually, right here, is just about 20 minutes from the border in Mexico. And so when I was working at San Diego Humane Society, we had volunteers who would live across the border and travel to San Diego for work. And so we started utilizing their volunteering skills, where they would take food back to Mexico and distribute it for the animals in need there. And that's how we started an informal partnership with the local government animal agency there. And eventually, we were able to expand our services by piggybacking on spay and neuter campaigns that they had there. And we brought our wellness team and our medical team there, where we were able to offer vaccines and basic medical care. And so we found that we were holding these clinics in local health centers there, where people, of course, had never been to a vet. But we realized that they were living in systemic poverty. Their animals were conversation starters to build trust with us. And we found that the knowledge that they had of their community and their animals was their superpower. And when they built trust with us, we found that they were asking us for healthcare needs and things like contraception. And we felt that we were there spaying and neutering the animals, and really, like, it was um, population control for the whole family in a way. So we do believe in collaboration and coalition building. We feel it is the way forward. It is my personal passion, and I feel that it has evolved in the way that I have created programs, and I was concentrating on San Diego as a case study in my past work, and now I'm able to take the work that I've done in these partnerships and have it all over the country and beyond. And here we are, talking to you all the way in Nigeria. And so there are organizations that are supporting increase, in access to care, to veterinary care and human care all over the country. And Maddie's Fund is a huge supporter in these efforts. And Open Door Veterinary Collective and Project Street Vet are national organizations where they are also increasing access to care. And I'm happy and privileged to be affiliated with these organizations. And so I just wanted to share this video, which is, a really good example of the human-animal bond. And once this video is over, I will hand it over to our next speaker, which I think is Janet. So here you go. I hope the sound works.
I think she's happy. Oh, I'm glad. You're coming back. I know. I told you.
There we go. Yeah, so We just heard and saw from Geraldine some incredible ways we can help keep people and their animals together. And I think that last video where there was we could just see the joy on that man's face. If we just froze that picture, I don't think there's many that would say he wasn't feeling very good in that moment. And that is a big part of why I'm a human mental health provider. And so when I talk about animals, people sometimes ask me, but why should I don't work with animals. Why should I care about, the animals that my people have? And actually helping keep people with their animals is very relevant to human health. We often think about it being important, in terms of not sharing diseases. However, not sharing diseases is important, but we can also have wellness and health benefits promoted to us. Next slide. So what I'm going to share with you is a bit about the science that has been coming out for decades, but especially over the past, I would say 10 years, it's really started hitting in terms of what's happening in our bodies and around us because of our positive relations with animals. Next slide. So when in the research literature, it's talked about animals helping people or animals benefiting people, having a therapeutic benefit. There's two main ways that animals are looked at as helping people. There's what's called the natural way. If you look at the top picture, you see a woman in a wheelchair. She has an animal with her. The animal is not helping to push the chair. The animal is actually in the chair. However, you don't see the rest of the picture, but she has a big smile. Her body is very relaxed. I think if we could see the whole picture, we would agree she is calm and she is petting that cat. So she is having some good feelings from that, but that cat is not trained to do anything. The cat is just being a cat who likes that person. The slide below, the second way is through what we call trained benefits, when the animal is taught to do things that help the person. So below, another person who uses the wheelchair, but in this case, the dog is actually hitting a button that opens doors. So two different ways that people are helped. Both people use wheelchairs. Top picture, person is feeling calmer. Lower picture, person is getting help with the door being opened. The second way takes a lot more time and resource. The first way is just about our everyday relationships with animals. Next slide. And understanding the ways that our interactions with animals affect us as human beings, as mammals, it's really the benefits they provide us fall into the same categories that come together to kind of form our health. We have the physiologic, our biology, our mental kinds of parts that can be affected, and then around us, our environment and our social. We saw pictures in Geraldine's slides. She started out with a woman who had nobody but her little dog. So for her social context, very critical to her to have that dog as her companion. Next slide. So the types of benefits, not trained, but the everyday interaction benefits that research is increasingly supporting, fall in those categories of our kind of human health factors. So we have our physiologic, far left, we have somebody, going on a run with her dog. Psychological, I tried to put a picture of somebody feeding a cat. Why is that a psychological benefit? I've worked with many people who talk about feeling needed, like my animals need me, I have a role, I'm important to somebody. So those are kind of psychological things that animals provide us. Emotional, actually I have a little out of order. Let me skip to social. Social, the picture of the boy with the backpack coming in and Kitty saying hello. For some people, that is, they're one of their main companions. It may be an indoor kitty, an outdoor animal, but an animal who greets you and appreciates you can make a big difference, having that social connection. And then emotional, the picture on the far right, we see a woman and her dog cuddling. She actually was having some chronic pain and discomfort and distress, and having another living being to comfort you. And there's research around those kind of benefits. Next slide. So physical benefits, to quickly summarize, I always would think, physical benefits of having animals as pets or companions. That's like if you have a dog and you walk around. Where I live, there's lots of animals on leashes, but we may, walk around in our communities or in rural areas. People, maybe actively working with their animals, but the idea is that you're having activity related to the animal. The newer area that is getting a lot of attention is what we call the contact related. And if you look to the picture in the far left, they're snuggling, they're having contact. Again, I would argue that cat probably isn't trained to do what the cat is doing. The cat is, proximity seeking. The cat is, liking the interaction, or being reinforced by it. What we're finding is when that's mutually, the person is receptive and liking it, and the cat, often both sides will have physical changes in their bodies that are associated with positive health. Our heart rate, our breathing rate, and our blood pressure tend to decrease when we have these positive social contacts. Why is that? There's a bonding hormone called oxytocin that is released, and that is thought to be associated with a whole cascade of things in our body, including these slowing of our cardiovascular processes. What's particularly important is these are the things that go up when we are in a fight or flight mode, which sometimes we need to be, but sometimes the stress that we face is more, we have to have a conversation with somebody, and being able to run faster, fight physically doesn't help as much. And contact with an animal can help bring us back to that calm place, physically change those things. Next slide. This is a statement from the American Heart Association 2013, basically saying there is enough research about these cardiovascular benefits that we are going on record. This is the biggest public-facing cardiologist health education organization in the United States. And, saying not that pets cure all heart issues, nothing like that, but that they help. They bring benefits that are worth paying attention to. Next slide. A couple more studies. This is a big cohort study, I believe in Sweden, showing that over time, having that animal can help in after you've had a heart incident, help improve outcome. Next slide. And this is a campaign that is currently happening in the United States by the American Heart Association, basically trying to educate people, being more intentional about, spending time with your animal actually helps your heart health. And again, biggest public-facing cardiology education. Next slide. Oxytocin, that's the molecule I mentioned that is believed to cause the cardiovascular sort of changes. Next slide. Psychological benefits I hit on, but you see the cat dad cup, self-efficacy, feeling like you're able to do something, you're needed. Geraldine mentioned people coming in for care for their animals, sometimes where they weren't necessarily looking for help for themselves, but once in a setting where they were getting help for their animals, also receptive to getting help for themselves. Next slide. I'm sorry, I skipped that one. I'm not sure what popped up in there. Restarting back over.
Hold on, let me look.
That's okay.
Social?
Social benefits. Let's go back up to emotional benefits. It's 26. There we go.
Okay.
Emotional benefits. These are the things I think most of us think of. This is those warm feelings. Again, oxytocin actually is thought to have a role in that, but this is, where we feel that comfort, that warmth, not just with other our animals that we have, relationships with, but our humans that we care for. We have these feelings that actually are predictors of health when we have connections like this. Next slide. Social benefits. Of course, the companionship directly from the animal, feeling less alone, having somebody else with us, an animal who's alive, but also animals tend to connect us to other people who like animals. If you have a cute animal with you, somebody may start speaking with you. So we call that the bridge effect. Next slide. Some bigger picture public health research is looking at the animal loneliness piece and the idea that this is something we need to support at the population level because it helps reduce isolation for people to have their pets with them. Next slide. And then all of these together are referred to these different benefits: physical, emotional, psychological, social, the stress mediation effect, basically that combined when we have our human stress response, the act of being with an animal, that emotional comfort, that petting to reduce our cardiovascular indicators can help mediate and reduce that stress. Again, oxytocin plays a role. Some examples of interventions that specifically build on these benefits. Actually, I believe he is with us, but there is a Nigerian vet, Dr. Sunday Agbonika. I hope I said the name correctly. If not, my apologies. Next slide. Let's skip over this one. The HARP study is a study, I can send you the article, that actually looks at changes in anxiety, depression, and loneliness when people are matched with animals and live with them for a year. Next slide. So here's just more about let's click through. There's the findings. Next slide. Here's oxytocin. It's going up 10 minutes. We would go in, ask them to interact with their animals for 10 minutes and test the oxytocin again. And you could see it went up in most of the times. Next slide. Cortisol, that's that stress hormone, is one of our stress hormones. 10 minutes with their animals, and it did go down. Now, again, these are people who like their animals. If it's somebody who's afraid or neutral, not going to probably happen. But cortisol is associated again with the heart going up, heart pounding, shortness of breath, blood pressure, all the things that fight flight. Next slide. A quote from one of the participants basically saying, changed his life for the better. Next slide. And I want to go back to Dr. Agbonika's program because I had seen some news about this. I believe there was just a conference that was completed. But this is a program that takes these benefits that we just looked at, and the focus is on helping connect kids with autism and other special needs to animals so that these benefits can help with those. There's a TED Talk I highly recommend where It shares, even a child who hadn't been speaking before, physically able, but not being verbal with humans, who was able to speak with a dog and then transfer that over. So kind of that social benefit happening. One of many programs internationally that is, doing cutting edge things to bring those benefits of animals to people. Next slide. And this was what I came up in my social media feed. So this looks like this was the animal assisted intervention conference that happened not too long ago. And with that, I thank you for your kind attention and patience. I am going to turn it over to Vickie, who has some wonderful information to share, kind of going right from where I'm leaving off. We have the health benefits. How do we bring that into human and animal well-being together?
Thank you so much for everyone for being here today. I am going to both speak really quick so that we do have time at the end for some questions and answers if anyone has any, but please feel free to reach out to me at any point in the future if you want to talk more. So yeah, I'm coming from the OneHealth Clinic. The OneHealth Clinic is going to be the clinical representation of everything that Geraldine and Janet have been talking about. This is a collaboration between the University of Washington, Washington State University's College of Veterinary Medicine, and a human healthcare clinic called Neighbor Care Health here. I'm gonna pretty much fly through this one because most people here will know the concept of One Health, where human, animal, and environments are linked. Nigeria has a lovely One Health strategic plan from 2019 to 2023 with the mission of building a strategic, dynamic, and functional platform that advances human, animal, environmental health through multidisciplinary and intersectoral collaboration. And that is what this is all about. The One Health Clinic is that collaboration between the veterinary field, the human healthcare field, as well as considering the social and physical environment that the individuals are living in. So this presentation is about a specific population in the United States, but at the end of the presentation, we'll talk a little bit more about how this can go outside of this specific population. We created the One Health Clinic as an integrated care model to provide veterinary care to people experiencing homelessness who have animals. And like Janet mentioned, this is more of the natural kind of relationship where the animal's peer presence is something that provides physical, psychological, and social support. This individual, Houdini is the dog. Houdini needs to go on walks. This individual doesn't really like talking to people, very isolated, but when he's in a dog park or amongst other dog owners, there is social outreach. It gives this individual reason to get up in the morning. We've talked to a lot of people where they did not commit suicide because they knew they had to wake up in the morning and care for the animal. So we wanted to address the health of both the owner and the pet by creating a clinic that would, because I did research, qualitative research with people experiencing homelessness with pets who indicated that they will wait for 2, 3, 4 hours to get vet care for their animal, but maybe they wouldn't source care for their own human health. So we created an integrated care model where we kind of bring people through the door for the vet care. And then the human health care is right there in the same clinic. In communication, the human health care and the animal health care are in communication with each other to create a single health care plan for the owner and the animal. So we work with Neighbor Care Health, which is what we call here a federally qualified health center where the government pays this healthcare clinic to provide free care for people experiencing homelessness. And then we worked with the College of Veterinary Medicine, where a veterinary faculty by the name of Dr. Katie Kuhl will bring her veterinary students into the clinic. They get hands-on experiences taking care of the animals, but also working with this very specific population that comes with a number of issues that perhaps they will not see so clearly in the future in a for-profit clinical setting. So a trauma, they learn how to do a trauma-informed care approach, understanding that people either come into homelessness with trauma or they acquire more trauma while they're in homelessness. So the team, so that is the team, Federal Neighbor Care Health and Washington State University. And our model is a little bit different than other clinical care models. The single care model is a traditional care. So you go to a physician's office, you get your human health care. You go to a veterinary clinic, you get your veterinary health care. Maybe the physician or nurse practitioner will ask people about if they have pets at home or if they have livestock in close proximity, but it's probably not likely. And the vet care, they may not ask, is there any illnesses going on at the home? So that kind of siloed healthcare is the single traditional model. In the United States, we have a referral care model where a veterinary clinic may have a social worker at the vet clinic who will schedule appointments with people in the future to go see their doctor because they notice that there's an issue. But that's a barrier of people getting to a clinic, getting there on time, remembering the appointment exists, transportation to the human healthcare clinic. All those can create barriers for follow through. There's a side-by-side care model where there's a veterinary clinic here, there's a human healthcare clinic here. They each do their work, but they don't communicate. But the transportation barrier was reduced, but it's not building on those possibilities of integration, and services remain siloed. What we do is a OneHealth clinical care model where the vet team and the human health team are in collaboration for each family unit, the human and the animal. So this is an example. This is a clinic day. The individual in the middle who's wearing all black, who's leaning on the table, is an MD, and then the vet students are around, owners with their pets. So that is how close the communication is between our at a clinic. People come to clinic and they're like, I'm just here for vet care. I don't need any human health. We have a protocol where they have to at least say hello to the MD or nurse practitioner or their human health care team. And usually those small conversations of just saying hello actually turns into a clinical visit on that day, even though they were not interested or relevant. Because what's really happening is the vet team is creating a positive healthcare experience that this demographic of people haven't often had in the past. They've had negative experiences with healthcare. There is a bias against people for being low income, being homeless, being LGBTQ, so they do not like communicating with the human healthcare world. But because the vet care is a trusted occupation, and we create a trusting, comfortable environment, they're more readily open to accessing human healthcare. This is also a teaching hospital. So we have the vet students, like I mentioned before, with Dr. Katie Kuhl there on the left, and then Dr. Peter Rabinowitz is the director of the program, and we have human healthcare students, med students, nursing students, social workers, nutritionists, different kind of health services coming through where they can learn how to collaborate, how to have veterinarians, the human healthcare workers learn the value of having a veterinarian in close proximity, how to work together, how to get questions answered that maybe they didn't even know that the questions existed. In the first year that the clinic was running, where the vet care was added on to an existing human healthcare clinic, the human healthcare team reported a 32% increase of human patients to the health clinic. And those most often were people who had not accessed healthcare for 2 years prior. And so it's been really successful model that we're supporting other sites to create. There's one in New York City, and we're working on one in Columbus, Tucson, and another of Toronto and another number of cities around the US and Canada. So this gives you an opportunity, having these human and vet teams together, you can address some things beyond, I mean, it's wellness, it's vaccines, but also things come up that, that maybe wouldn't have come up in siloed clinics. So you have pets and owners with shared mental health concerns, and we can approach that through, we work with the animal behaviorist and trainer of how to benefit both mental health. Shared environmental risks. We had a cat come in who had a cataracts, and which they think maybe from toxoplasmosis, and then we found out the owner was pregnant. So we're able to address those things in real time. The ferret on the far right ended up having influenza, and that is a zoonotic disease between humans and pets. So we've learned the value of free veterinary care brings people through the door and makes them more open to accessing human healthcare. Treating the human-animal bond as a unit improves the healthcare of both of them. Training students together, the vet team and the human health team, can build more empathy, more skills, more collaboration for this One Health approach. And the data are showing quantifiable benefits to this model of care. And this really addresses Nigeria's One Health strategic plan in terms of surveillance. You can track what is going on in the community, training and research, really getting that interprofessional knowledge going on, and communication with the population on how to improve or the benefits of that human-animal bond, leveraging that human-animal bond to communicate zoonotic disease outbreaks, just general disease, environmental risks, etc. And then finally, we created a toolkit, and this is free at www.onehealthclinic.org, and it really kind of takes you through the process of creating and replicating a clinic in your community. Whew. That was it. I kind of flew through that. Oh, and there's a thank you slide. So if you need to get a hold of us, actually. And then, yeah, that's it. And if there's any questions.
Thank you so much for your wonderful presentation.
That's a very interesting presentation. Thank you all. So we have a few questions in the chat. I'll first start with this one. It says, with the increase in backyard animal farming, do you think people also keep these animals for other reasons besides food? And do you have any animal welfare expert in one of the OneHealth Clinic team? Anyone to answer that? Yes.
There we go. I'm sorry,
Yes.
I missed a slide. I don't know, one of my slides is missing, but how this can be incorporated in backyard animal farming in rural settings. I mean, this model can be used across the board in terms of like a One Health Clinic model. If there's a vaccine campaign for livestock, you can have a vaccine campaign for animals and humans and their families. So absolutely, there is. And in terms of besides food, I will let someone else respond to that, but we do work with our Seattle Humane, who is an animal welfare organization within our clinic. But perhaps Geraldine or Janet has an answer for the
to that. Okay.
The first question.
I'm going to give it to
I can actually speak to the animal welfare expert, because I can say that, like, in the clinics that we held and any interactions, none of us were veterinarians, but we all were trained in, active listening skills and trying to really get to the point where we could build trust with, our guests. And through that, we were able to, get stories about them staying in, say, for example, a domestic violence situation with their animals, which they weren't able to tell us before, or, that they were living in their car with like 6 cats. There are lots of different stories like that, but I feel like, we felt like we were not animal welfare experts trained or certified, but in the sense we were through our experience.
Okay, thank you for that. And then maybe this one is directed to you, Vickie. Says, how can zoonotic diseases be prevented during human-animal relationship? You can just give a try to that one. Yeah.
You've muted again.
Okay. How can zoonotic diseases be prevented during human-animal relationship?
I think the OneHealth Clinic model can really address that, because if you're seeing both the animals and the humans at the same time, each can be a sentinel for the other. That if there's something if there's signalment in the animal, you can ask follow-up questions amongst the human to see if there's some kind of shared risk going on or zoonotic disease. So I think having those two things in one clinic can really address where those zoonotic disease episodes are occurring.
Yes, true that. Good. And then the other question says, what are some considerations individuals should keep in mind when deciding to bring a pet animal into their lives, considering both the benefits and the responsibilities? This is such a very good question. Yes.
I can speak to
answer,
that,
you go.
Janet. Do you want to? I don't want to be the only one talking, but I'm happy to speak to that.
Oh, go ahead.
Yes.
Yeah. What we found was that, working in animal welfare, by having various qualifying criteria for people to adopt a pet or to bring a pet into their home was actually a barrier. So, for example, if a person was experiencing homelessness, many animal shelters would say, you may not be able to feed yourself, so you cannot have a pet, or you're living in your car, or whatever it might be. And we found that the more barriers we removed, we were able to get pets into homes. Because if, for example, someone had a child at home and the dog wasn't friendly with children, we could find a home for that dog where there were adults. Or if it didn't like other dogs, we could find it a home where there were no other pets. But often animals were being euthanized in the past because they weren't matched and the animal shelters were getting filled. So by removing these barriers, we are kind of creating more opportunities for animals to be placed, and giving the option of animals to be brought back to the shelter if the situation doesn't work out.
Yes.
That's a great answer. I thinking just at the kind of from a human service lens, just thinking about the type of animal, if you're getting an animal and the animal's basic care needs, and are you capable of doing, the basic things that, so if you're, or do you have people that could help? If it's, you're housebound and you want a dog and they're not allowed to run loose where you live, are you able, do you have some place to let the dog out? Can you walk? Just sort of the practical things, I guess, that are the animal's basic needs that, are you able to, and is it, and how much stress is that going to be? Because it is a relationship, and like every relationship, there's the benefits like I talked about. But there's also, there can be a stress. The stress can be financial, or what the animals care, or the animal has the behavior. So, it's a balancing. So just, keeping that in mind, that and thinking about, what your own, your situation's best. And I talk, so for some people, they're like, it's worth it. I can make it happen. Here's all the, things I can do. So it's just, yeah.
Okay, thank you. Yes, this other question says, how do you encourage people to bond well with a particular animal that is culturally discriminated against? For example, a lot of people in Nigeria don't bond well with domestic cats due to their cultural beliefs regarding the cats. So how well do you encourage people to bond with such an animal? So yes, maybe Janet, yes.
Would like to respond. Yeah, but the program, the heart program I showed you, we actually had people sent to the program by their doctors, who then went to our animal shelter partner and the animal shelter staff helped. It was like matchmaking. And one person's perfect relationship was another person's, oh no, this is not going to work. So it's always about starting where the person is at. We had people that were dog people, that no cat, no way. But then the dog persons, dog people, we had people that wanted a dog who, we call them couch potato, but like a dog who would just sit with them and maybe walk around outside a little bit, but not, so we had some people who looked for those dogs. We had a couple people who wanted a dog to walk and play and jump, and each of them had their good match. But if I had switched their dogs, even though they were both dogs, that would have been very bad. The dog that was jumping and running and playing, if that dog had gone with the lady who wanted a little dog to sit next to her and watch TV, that would have been very upsetting. That would have not been a benefit. That would have stressed. And the opposite would also be true. So I think in terms of encouraging people to bond with animals, we kind of want to start with what they're comfortable with and build out from there. If they have particular species that they're like, wow, that wouldn't be where I would start. I would start with who they're gravitating to.
That's very good. And then the other question says, I'm sorry. Can good human-animal interaction help reduce stereotypes in animals?
Can it help reduce, what's the last word?
Stereotypes.
Stereotypes in animals?
Great question.
I think so. We have in the US, we have things like cat cafes where you go to a coffee shop and there's cats wandering around and you can just sit there and pet them. And I know in Japan they have pig cafes where you can drink coffee and pet pigs. I think those opportunities for people can they can see that maybe their stereotype, like if they're afraid of dogs and they go to a space where there's a bunch of relaxed, friendly dogs, could benefit those stereotypes.
And I agree with Vickie very much. I from looking at when I've talked with human healthcare providers, and I sometimes get the comment, but it's just an animal. So I guess the stereotype being that the animal doesn't matter very much or have much value, but when they see the changes in their patients' heart health, or how the human patient's mental health, like I think both Geraldine and Vickie talked about people saying that they had stopped from suicide because their animal depended on them and they didn't want to leave that animal out there with nobody to look after them. Those are tangible benefits that get people thinking, well, it's just an animal for me, but they're making a real difference. Like for many people, animals are very important, and for that reason, it doesn't have to be that I like animals. If I'm a healthcare provider, knowing that the animals are helping people is enough. And I think that helps to reduce that it's just an animal stereotype, because we can see that the relationships with other humans are making real differences for people, because animals have a lot to offer.
Yeah. If I can just add to that real quickly, because it's a good question.
Yes.
Although, like, I would like to say that, even human to human interaction can help reduce like the stereotypes in other humans, which can ultimately help animals. Because, for example, we had a gentleman that used to cross the border from Mexico and bring his kittens to us to get spayed and neutered, but he would keep getting more and more kittens. And we found that in the beginning, when he came to us, he would just want cat food. And we were wondering how much of cat food he wanted, and we realized he was drowning the litters of kittens because he refused to get them spayed and neutered. And in the beginning, we had two schools of thought, where someone was like, no, you cannot give him any more food because he's drowning these kittens. But when we engaged in conversation and tried to understand where he was coming from, it took us a year and a half. And finally, he understood the benefits of spaying and neutering, and he was able to bring his kittens to us, and we were able to control that population. But if we didn't sort of give him that understanding and compassion, a compassionate ear, he would have continued to drown those kittens and never spay and neuter them. So I feel it ultimately benefited the animals, but we needed to know how to interact with him as well.
Yes. And actually that made me think of one more thing with cats. And I thank you for sharing that, Geraldine, because I think that is so important. Again, if I start where I'm at as opposed to where the person is at, it's not going to go well. And I love that example, Geraldine, because it sounds like your team took time to understand him and build a relationship. And then you were able to work together, you and your team and him. Cats. So the dislike of cats, we have some of them. There, many people like them in the United States, but there's still, a fair amount who don't. And I did see a question in the chat. I think that was read, and the interacting with humans, just like Vickie was saying, like that can help change. The opportunity to interact with a friendly cat, if there are those kinds of opportunities. I know, Sheehan, you had talked about doing programming with, about species that people aren't as fond of. And like I live with 3 cats, and there's 2 that most people would be like, yeah, they're cats, they're hiding, I don't like them. My 3rd cat is friendly. She will bring you her toy. She will sit next to you. She will put her paw very gently on your leg. She makes friends with people that don't like cats. I haven't trained her to do, so I think those, just like meeting people that are different, that we think maybe, not good thoughts about, but then meet one and we're like, wow, that's actually not such a bad person. If we could, people having opportunities to meet a cat who is sort of a more friendly, representative of the species, can sometimes go a long way towards beginning to change attitudes, just having that positive interaction. Because after, just watching them with my one cat, they're like, I never knew cats were like that. And I'm like, depends on the cat, I guess, but.
Yeah. Oh, yeah, that's very true. That's very true. The last questions, it was just a continuation for the issue with the black cat in Nigeria regarding the culture and tradition. So it says, so how can we help them overcome whatever culture and tradition that they have?
Maybe I can have a go at it. But I found it was very interesting. Like, I have a black dog, and I love black cats. But when I came here and found that, because of Halloween, like, black cats are a bad thing, and I just feel that when it's a cultural change, it's going to take time. It takes like a period of time. And we found, even like, say, in India, for example, when I was growing up there, we didn't have cats as pets, and people didn't have street dogs as pets. People wanted pure breed dogs. So now, I've lived away 26 years, and when I go back, it's almost like a cool thing to have a street dog as a pet. So I feel like it's the cultural change that has happened, and I think it's the same thing, with having a pet as a family member. Pets were considered property here, but now they're considered like a family member. So there are all these different shifts that are happening on so many levels, and I think it's just interesting to see.
And I wonder, I have similar experiences with, black cats, and then there's still many people in the United States that think they're, bad luck, or, things like that. I have a black cat. I like her very much, but I think representation, like where you can, I mean, you don't want to turn people away entirely, but like, for example, in Vickie's background, she has some little, looks like pit bull mix puppies. Like that's a breed that many people are, or a type, not a breed, that many people are afraid of in the United States, and that are abandoned at very high rates. So, sometimes being intentional about, like, that's a cute picture. It would be, I don't know, most people probably would look at that and not think that's scary because it's two puppies playing. So just sort of starting like in small places, but, like thinking would there be an opportunity to do something with a cute black kitten that wouldn't have the audience go, oh my gosh, that's bad luck right there. We all know the cultures we work with, so we want to be sensitive and respectful always. But when we have opportunities to kind of, I could put in this cat or that cat, if you think it's not really going to make too much of a difference, if the cat has a lot of black, maybe put, that kitty in the picture. Because, yeah, she could have had two Labrador retrievers or, real popular dogs in the United States. But I don't know. I'll ask her, is that deliberate, Vickie, that you have that?
Well, it's interesting within the community I work with is that, and that's actually in our shelters, our animal shelters here, the majority of the dogs in shelters are of a pit bull breed because of this stereotype. And so it is one of the easiest types of dogs for the folks that we serve to get. So it just so happens that we have a lot of pit bulls and a lot of chihuahuas. It's just how it is.
Yeah.
Okay. Just one last question to you, Dr. Janet. Okay, yes. Could you stress out the importance of positive human-animal relations in regard to animal welfare?
Yes, I think from the human side, I talked a lot about the benefits and the really it falls under the different dimensions, the different parts of our health, our physical health, our mental health, our social and psychological health. And there's bodies of research that are supporting those for humans. But at the animal welfare side, that needs to be paid attention to also. So for example, I had a picture of a dog that was, learning how to open that door, like Service Dogs, Assistance Dogs International actually has welfare standards for the dogs who are trained in those roles. We have what are called therapy animals. So that's basically like an animal who is somebody's animal. Vickie's got one.
I have to go. Thank you all. Sorry, I have to go to a OneHealth conference now.
Oh, that's a good reason.
Thank you.
Thank you. Yeah, therapy animal, visiting people at hospital, nursing home, school, doing great things for people, but how long should that animal work? That animal needs breaks, that animal needs water. And by breaks, there's some groups in the United States working on standards for that. Like they should work 2-hour blocks and then have time where they're left, they're not pet. And having handlers understand basic body language. Again, I'm not an animal behavior expert. I'm not a veterinarian, but I've learned, basic stress signs so that I can speak up for my animal if they're, sort of starting to shut. That's when it's time to end the visit. They need a break. So it's a partnership. If it's gonna, the animal's gonna stay healthy. And also I guess I should speak to fit. And again, I'm not an animal expert, but it's about, for some dogs, visiting a bunch of new people is great. And they're very happy doing that work. I'm thinking of one of my little dogs. He would do it if I asked him, if I took him, but he would be not okay It would be very stressful for him. He likes his family and he likes new people, but not a whole lot of people at once. So it's a partnership, and that's where the animal welfare experts and all of that knowledge can keep the animals well, because when the animals aren't well, they're certainly not going to be able to help the humans as much. So it's just a mutual win-win that we want.
Okay. Thank you so much, Dr. Janet. And then Sunday, can you please go through with your comment?
Good day, everyone. Thank you so much. For me, this is a topic that is very dear to my heart and all of that. So thank you. I probably just wanted to just share something that happened today and all, as I felt it could also help in answering some of the questions that were raised earlier. So if you probably have followed me before now, like the TED talk that Janet mentioned and all, you hear me talk a lot about a special needs center in Abuja, that's where I live in Nigeria, where we normally would go to and all of that. That was the first place where we did the assessment trial in Nigeria, where we found that this was of value to us. And so if you may have heard me before now, you hear me talk about 2 boys that it was of value to at the center there on our first visit in 2018. So today, I just got back from a visit to that same center again some hours ago. We usually would go there every now and then, So just to share this story. So those 2 boys I talk about a lot. So one of them is Fela, that's his name. The other is Stephen. Fela is no longer at the center, but Stephen is still at the center through dates. And so I am able to measurably see the difference in Stephen's story from 2018 when we first met him to 2023 now that this thing and all, and his story is remarkable. So in 2018, when we first got to the center, we didn't know the story at all. We're just there with the animals and all, and then see the interactions. But the on-site staff gave us the feedback that for these 2 boys, this was of breakthrough potential. And that's because of everything they saw. These boys were non-verbal, they were non-communicative, they were expressionless before this visit. And then we came in with the dogs, and then they'd see the joy and all of that communication that these boys are doing and all. And then, so that was 2018. Fast forward to date. So now the on-site staff gave feedback to the parents as well of these 2 boys. And for Stephen, what his parents did when they heard this, his parents are not dog people. They don't like dogs. But now they've heard that Stephen, dogs could really help Stephen to progress in his growth and everything. And Stephen is autistic and all. So his parents got him a dog. Today, we've seen Stephen grow over the years. Every time we go there, we now go with various animals and all. But every time we go, Stephen is stuck on the dogs. For him, it's just the dogs. And now we've seen how Stephen has now measurably grown over the years. We were there today, and holding a conversation with Stephen and asking him about his dog, the dog his parents got for him. He was telling me his dog's name is Crystal. And I asked him, okay, what do you do for your dog? How do you take care of a dog? And he shared a number of things that he does for the dog. He was telling me how he takes the dog on a walk, how he bathes the dog, how he plays and cuddles with the dog and everything. And I mean, all of that for me was just amazing and all. And so for the teachers on site, the therapists and all, this is something that they've now used to build into Stephen's individualized educational plan. The parents at home, well, for those of us in Nigeria, we know the level of stigma and all that is in the autism space in Nigeria. So the parents today don't exactly want to associate directly with me just yet. I don't know the parents, but I know that because of our work, because of our presence, they've gotten Stephen a dog. And now Stephen has grown measurably from 2018 when we first met him to today. So it's just one of the stories to share to say that yes, human-animal bond can have measurable impact in our lives, both we neurotypicals and even people who may have issues, both mental issues and even special needs. So thank you very much.
That's a very good story. Thank you for sharing, Sunday.
Thank you so much, Geraldine and Janet, and also to Vickie. And thank you to all the participants. Thank you, Sunday, for sharing your story. And at least we can see your work that was shared. And this shows that at least we're trying all we can do to see how we can help, animals in Nigeria, both companion animals and also farm animals. So I want to appreciate everybody for joining and for the wonderful questions that you have really asked. It showed that you found the presentation interesting and, a lot of things to learn. And I hope this will bring, a kind of change in our behavior, in our attitude, and probably the way we can also relate with animals wherever we find them. No, it may take time, but at least with the knowledge, I believe with knowledge, gradually there will be this change. So I want to appreciate our speakers as well, because it's very, very early in the US and they actually were happy to sacrifice, to wake up 4 a.m. to be part of us. So a big round of applause to them. Thank you so much for your time. And I hope to continue this collaborative work with you. If there's any other opportunity to invite you, maybe we have a longer session or for any conference, then it will be, more time to interact. But with that, I say a wonderful afternoon from here and morning to you wherever you are, or evening wherever you are all over the world. Thank you so much for your time. And please, the last thing is, the Animal Welfare Group Nigeria is on Facebook. Just type in Animal Welfare Group Nigeria, and also on LinkedIn, Animal Welfare Group Nigeria. On Twitter, we are at AWGN14 in numbers. So please, you are free to share your experience about today's meeting. Let's try to share and spread the word. And also, you can check our YouTube channel for previous webinars, and hopefully very soon this presentation will be uploaded on the YouTube channel. So with that, I say have a lovely day wherever you are, and bye-bye.